Originally, there was a support group here in town set up by Kitty Sorahan about 15, 16 years ago. Her husband was one of the first diagnosed in this area, and there was no services. So a support group was set up, and about 14 years ago, a group of people approached Kitty about doing a fundraising for the group, and the decision was to build a daycare centre. So they contacted the Alzheimer Society of Ireland and decided to go under their umbrella, and they fundraised the money, over 450,000, and it was built and ready for open on the 1st of June 2000. The Birches runs as part of a partnership. We are under the auspices of the Alzheimer Society of Ireland, and we receive funding from the Department of Health, which funds about 35% of our total running costs. We run a daycare service 5 days a week from 8:30 to 5 for people suffering from Alzheimer's disease or an Alzheimer-related dementia, such as a mixed dementia. The service is not just for the person who has the illness. Primarily it's that, right? We are their advocates. This is their place of safety, where they enjoy themselves and have fun and feel accepted. But also we provide services to the family. We support the family, because most of our clients could not possibly stay at home without the huge support they get from their families.
My name's Sonia Cassidy. I'm from Dundalk, and my mum is a patient at the Birches here. Mum was very young getting it. She is just turned 70 last week, and she probably has it now about 6 years. So she was quite young getting it in the beginning. She was a very active woman, loved life to the full. She loved walking. She was always out with her sister. Very much took a lot of pride in her appearance, and it kind of started to go. She wasn't as big into her clothes, and just small things like that we noticed. Even at home, she loved watching the soaps in the evening, and it kind of went then. A few silly wee things she would forget, not major, and then kind of starting to repeat herself a lot. So this went on for a long time. She never ever went to a doctor in her life. Just was one of them people that didn't think, she was never had a sickness. She had 6 kids. She went into hospital, had them, and that was it. So doctor, it wasn't a thing where she went to a doctor or she had a medical history or anything like that. So it was another problem that we had facing us. So I basically went to my own GP, and I explained to her that I was quite concerned about her. She was still driving at the time. We knew things were getting forgetful. This was a main fear of her in the car. So she had said to me, look, try and get around to me and we'll see what we can do. And I explained that I was taking her around pretending I was going to the doctor and she was coming with me. When I went round to the doctor forgot that I had been in with her. It was an absolute nightmare. It was disastrous. So I couldn't take it. She kind of copped it. There was something wrong when the doctor was saying to me, what's wrong with you? And I was trying to say to her, it's not me, do you not remember? So it kind of put her off going near. She wouldn't actually come with me for months then, so this was kind of all going on and on. We heard about the Birches then, just through word of mouth in town. Different people had said it to me that it was here. So originally I'd come up with my dad and we spoke to Olive probably about 3 years ago. And I have to say she was fantastic from word go. When I first met Olive, she had told me then about their meetings every month, so I started attending the meetings and it was good to speak to other people that, in the beginning have that sort of, don't know where they are, where to go, it's all new to everybody. So even just to speak to people about your problems or just to get it off your chest was brilliant. And then it was great to have Olive, and there was different people would come into different meetings and speak to you, and if there was anything you needed to do, there was any amount of information there. So it was brilliant for me. It's over a year now that she's here. And I just have to say, without them, I don't know where I would be. They are absolutely brilliant. My mum is that far gone now that she doesn't recognise any of her family members. She's totally dependent on us for care. She's one-to-one. She can't be left on her own at any stage. And she went through a lot of different stages with it. She was very agitated, never really aggressive, but just had an awful time for a long time. Her sleep pattern was disturbed. It's endless, really, the problems that she had. She's now at a stage where she's sleeping very well and she's eating well and she's not in pain, which is kind of what we go on. But she comes to the Birches Tuesday, Thursday and Friday, and only for the help that I get here, it just, I don't know where we would be.
We have a sister group in the community, the Alzheimer Society Home Support Group run by Maeve Montgomery, and we work very, very closely together. So we work as part of a team in the overall community, and we're 9 times out of 10 the link for the family and the client in accessing what's available. The branch, there's a chair, Bernie Doherty, Mary Garcon, the secretary, Brian, the treasurer. They're the management team of the branch, and they fundraise, they come up with specific ideas. So yes, of course, we always need that. And we're also very conscious of not constantly going with the handout. You don't want people to be tired either, and you can't keep going back to the same people. But having said that, we have met our bills at the end of every year, and that's through community support over 10 years. So there is no way we can say that the community has not maintained the service, because the whole volunteer and the whole ethos of supporting here has kept the doors open and, most importantly, kept the quality of service that we strive to maintain. It's been funded by the community. So that's a huge, huge success story. The challenge will be to make sure that continues into the future. I'm probably of the old school, and that is that how we treat our citizens of this country in their golden years is a reflection of the society that we want. People in my care that I am privileged to have here have worked all their lives, have made major contributions to families, raised families, had businesses, built this country. And if we cannot give them a quality of life at this stage when they so desperately need it, I mean, bad enough get old, but to have to cope with this illness, the very least we can do is provide that level of care that they deserve. The United States government has invested massive funding in 8 different research areas, 8 different divisions, because they recognise the economic catastrophe that's going to occur if a solution to this illness is not found, and found quickly. So they have made huge strides and put an awful lot of money in. There is great research going on here in both Trinity and in UCD. For us as a small unit going forward, well, if JP McManus came to town tomorrow and ran a golf classic and raised money for us, I would say respite. If we had unlimited funds and we were not in the economic climate we're in today, on a wish list 10 years down the road would be to have the ability to provide respite in a venue similar to the ethos and the facility we have here, with a similar team that our clients would feel comfortable in and safe in. That's very home-based or very comfortable, not institutional. We're 10 years going. We're 10 years open. The first decade's over. And the level of service is growing. The number of people we're dealing with is growing. And I think what I would like to say to everybody is that a thank you for the support, be it, hugely the financial support, but also the support in help in, activities that we do, in if we're going out, the other things that go on around here, the massage therapy, the nice days out. People have rowed in and helped us out and helped, but particularly in funding, because this service is still alive because of the local community. And that has to be acknowledged. And if in 20 years' time I'm sitting here with yourself or somebody else and we're still having this discussion, then I think we have achieved an awful lot.